One of the reasons why this clinic was created was a recognition in California that we needed transformative ways of doing mental health services. Our job was to convince the community and the policymakers that cultural competency, when put into action, is transformative. I think psychiatrists have a critical role, a very critical role, a critical potential to improve the circumstances of poverty, health disparities, and unequal access. Society still, for the most part, believes that doctors are impartial except to further the best interests of their patients. And that is a really important trust that society gives to us. And so I've been to community meetings where policies were, decided, where my testimony to the needs of our underserved communities held a lot of weight because people felt, and I'm honored that they felt this, because that's what I try to do, but they felt that I was being impartial and that I just had the best interests of others in mind. Whereas if I am not a doctor, and I've seen this happen to my colleagues whom I work with, who aren't psychiatrists, there's a suspicion that, what's in it for this person? Do they want their business to flourish? We doctors still maintain trust for the most part, and we need to earn that trust by truly investing in the best interest of people. I think the bottom line is that we as physicians, we as psychiatrists, have unearned privileges. And every day we have to check ourselves and see if that day we've earned that trust. And that's, I think that's at the core of a physician's ability to work in the community. The history of Transcultural Wellness Center actually dates back to the 1970s when the original founders, Luke Kim, being one of those, he's a Asian American psychiatrist, sort of saw a need for social supports in the Asian American community here. They developed a program called Asian Pacific Community Counseling, which for many decades was just focused on social services support and interpretation services. I became involved in the mid-2000s when there was an opportunity to apply for funding to create the Transcultural Wellness Center. The Transcultural Wellness Center is a collaboration between UC Davis, so myself and another psychiatrist, Dr. Alan Kouike, collaborated with the nonprofit Asian Pacific Community Counseling. So it's really, I'm the founding medical director of Transcultural Wellness Center, but it really has been a collaboration between many people in key institutions here, as well as the Asian American communities here. There was significant motivation to develop a Asian American mental health service. When the county officials looked at the penetration rate of mental health treatment into the Asian American community, especially the Southeast Asian community, they found very, very limited penetration. And this is consistent, of course, with what we were seeing nationally as well. And so given those statistics, as well as mobilization of the local community members here, the Asian American community members, we became a very strong voice in the process to develop innovative community mental health services. And that was how the Transcultural Wellness Center was essentially born. So Sacramento in 2002, Time Magazine named Sacramento the most diverse major city in the United States. So that's that was reached national attention. What they found, however, was that the diversity was very integrated. So if you looked at a given zip code, there was a lot of integration, unlike in other cities where we saw like greater pockets of ethnic diversity. People tried to address Asian American mental health in the various clinics, but what would happen is that there would be one case manager that had an Asian language, but then they would be transferred to another clinic, and then the population from one clinic would dwindle down. So there wasn't a uniform, concentrated effort. And the problem with that then is that you can't really give Asian Americans a sense of community when they come to clinic. And so this clinic, the Transcultural Wellness Center, we focus on 8 major language groups within the Asian and Pacific Islander community. We have 11 languages represented in-house. And so when we have community get-togethers, we have the critical mass to really embody culture. Whereas if there was just like one counselor, one psychiatrist here, one case manager there, you can't really develop culture in the same way. We're a training site for social workers, medical students, and psychiatry residents, child fellows, primary care physicians. And so what we can do is we can build that infrastructure, build that workforce, and whereas if you don't have that critical mass, it's very hard to do that. One of the reasons why this clinic was created was a recognition in California that we needed transformative ways of doing mental health services. And so the state passed a proposition called Proposition 63, which was geared specifically to fund programs that have a potentially transformative impact on the way we think about mental health services. And so our job at UC Davis and our collaborators was to convince the community and the policymakers that cultural competency, when put into action, is transformative. And so this clinic has really been a proof of concept for the cultural principles that we teach in our cultural psychiatry classes. I think there's been significant impact that the Transcultural Wellness Center has had on the level of patients. Every clinic, every community clinic in this area gets a report card from the Division of Mental Health that looks at recidivism, adherence, hospitalizations. And our program has seen a reduction in rehospitalizations by about 80%, crisis visits by 70 to 80%. They've been able to, we've increased the connection to primary care physicians by 80%. We've decreased homelessness as well. So from a individual patient standpoint, we see those impacts. From a community standpoint, we've been a center for the community to rally around. So we have, for example, elders from the Vietnamese community come here, have activities, teach younger generations. So there's a passing on of culture that we play a role in. As a psychiatrist who's worked here, I've seen some pretty amazing things. We collaborate with traditional healers here, and we'll facilitate our patients if it's relevant for them to connect with the healers in their community. And so we've seen greater collaboration and dialogue with traditional healers as a result of that. And so when you think about mental health from the standpoint of community as well as from the standpoint of patients, I've been proud and humbled at the same time at the results that we've seen. So we have a pretty diverse patient population. When we first started out, it was a challenge to reach out. fortunately, we had a lot of clinicians and providers that were well connected with the community, and so our reputation started to develop there. We also worked at non-traditional ways of referral. So, for example, in Vietnamese culture, the point of contact for healthcare is actually pharmacies. So in the old country, you wouldn't go to your doctor if you had a problem. You would go to your pharmacist. And then the pharmacist would prescribe medications, and if it was challenging, they would say, it's time to go see your doctor. So we have we developed a relationship with a local ethnic pharmacy, and we started seeing referrals from them. From churches as well, from spiritual and community leaders. And then word started spreading in the community. So we would have patients or clients, as they're referred to here, clients would say, hey, this clinic helped me with such and such, why don't you try it out? So we saw a little bit of this breaking of the traditional stigma associated with mental health. It's still a big challenge, but it's more of a conversation now in our community. So a lot of our services occur at the client's home, at the school, in temple. We try to meet the clients where they feel most comfortable to meet us. So the majority of our psychotherapists and service coordinators will meet our clients at their home. The psychiatrists will do the bulk of their work in the office, but they will also do home visits as well. And so, I had a client, for example, that had really bad experiences with mental health, and so was very afraid to come to anything associated with the mental health label. And so for years, I would go monthly to her home, get to know her family, and got a lot of insights into her ability to function. She was very psychotic, and in the office I would have thought that she was just very disorganized. But at home, she was, when I conversed with her, she was still quite disorganized. But when her grandchild was playing with something that was dangerous, her attention just focused on the child. She got the toy that was dangerous, and I would have not seen that had she been in the office. So the power of being in the client's environment and seeing them shine in ways that you wouldn't see in an office environment. We do outreach. So one of our members is rarely in her office because she spends her time with Korean elders. And so she is mainly offsite, comes in every once in a while to check in, but her work is out there. We have a family wellness center that's part of the APCC organization. And we have Polynesian hula dancing, so community members come in to participate in that. We have ballroom dancing that our community members have set up. We have language classes, and we have computer classes. And we try to get people together from different generations because of the generation gap can be very significant in the Asian American community. Then one of the things that we are starting to do is we now have a permit to have a kitchen open up to community members. And so one of the things that's that we would like to do, currently we have a farming group. And so our clients, many of our clients come from strongly agricultural societies, and coming to Sacramento in the inner city, it was a big source of distress, and cultural disconnection, not to be able to use their hands and to farm and to use the knowledge that they've developed. So we have a farming group. They farm, they bring produce back to their family, they leave some here. Our next step is then to engage our community in cooking culturally healthy foods and using food and preparation of food as a medium for cultural exchange between the different generations. We have to remember that many people from Asian American communities experience two senses of disconnection: being disconnected to the mainstream society, being disconnected to their own ethnic group because of the mental health issues. And so in this clinic, they've been able to reconstitute a sense of community and a sense of cultural identity. So they get a lot better. However, one of the challenges that we face is that when a person reaches a certain level where they are doing well, they need to be transferred out. The challenge that we have, and we're working to explore solutions for this, there's nowhere that they can go and still preserve that sense of cultural identity and connectedness. And so, so we've started to reach a point where it's the next phase, I think, of how to think about our work in Sacramento, which is we're experiencing that people are recovering from mental health conditions. Part of that is their sense of being part of a community, and then how do we then extend that so that when they transition out, that they still maintain that sense of community. But one thing that I think in regards to building community infrastructure, so we're a clinic, we get funding. One of the things that I've been thinking about is how do we infuse the community, the API business community, with some of the funding that we have to do some of the work that we do, thereby improving the community, the Asian American community infrastructures. So an example of this is we have funding to subsidize housing for our clients, and many of our clients struggle with poverty, so it's a very important resource to give. What if we were to, develop a collaboration with an apartment complex or a cluster of housing, whereupon they would be able to accept our clients? Then there's a community that's being built there. That owner starts to develop a sense of what it's like to be part of Asian American community services. They start to develop their connections, and then it builds. And so that we're not just doing everything ourselves, but really becoming part of connected to the vitality of the Asian American community here. My 10-year thoughts about Transcultural Wellness Center is I would like to see the center help to develop the community's infrastructure. That's a big piece, because as we've talked about, when we look at health, it's the social determinants of health that actually have the most impact. And so while I believe we are doing good work at the center, we really need to focus our energies on addressing issues like access to nutrition, access to safe housing. I'll give you one example. One of our clients came to me and said, I can't sleep because it turned out he was in a neighborhood where there was a lot of violence. And, my traditional psychiatrist hat would say, oh, you have post-traumatic stress disorder. Let me give you something to help you with the sleep and to help you with your hypervigilance. However, that from the standpoint of the patient would have been dehumanizing, because it would send the message of, I know that you live in a dangerous place. Your body's telling you to beware, and I want you to ignore that. It's very dehumanizing. What we were able to do was to relocate. So he and his service coordinator looked around for a safe neighborhood. They were able to identify a safe neighborhood. we were able to put down a deposit for him to go there. He's been doing much better, saving society much more money because he would have been on chronic, medications, whereas the deposit was not that much, but it was beyond his means. So the idea of empowering the community, both economically, from an infrastructure standpoint, I hope to see that we at the center have a meaningful impact on that. So I would like to convey a message to young Asian American psychiatrists, or those who are interested in working in the field of cultural psychiatry or Asian American Pacific Islander mental health. I would say that it is so needed. We need you. The more people from Asian and Pacific Islander communities that become psychiatrists, just by fact that we become psychiatrists, helps to diminish the stigma. And stigma is such a profound barrier to good treatment. Some Asian American Pacific Islander psychiatrists don't want to do this work, or are afraid to do this work because they don't have the language capabilities. And the message I have for you is, I struggle with speaking Vietnamese. My mentor wanted me to work in Asian American mental health services, and I was very ambivalent about that. I thought that I would do no good. I would say that there's a role, because many of our patients actually struggle with cultural transition and conflict. A lot of my elders who are patients will struggle with trying to understand why the younger generation does what they do, and can they actually connect. And when they see a psychiatrist who struggles but tries to speak the language, and I try to speak Hmong, I try to speak Cantonese and Vietnamese, I think I fail humorously, but it's that effort that gives hope. And it's the relationship that you build with your clients that model a way for the elders to reconnect with the younger generation, and for the younger generation to connect with the elders. So there's a role for many people in the field, and there's a significant need. So I hope you take that challenge.